What if I told you that the numbness in your feet right now could be the very thing that leads to a fall you never see coming? Not tomorrow, not years from now, but in a quiet moment, getting out of bed in the middle of the night, walking across your living room, or stepping onto a surface your feet can no longer fully feel. As a clinician who has worked with older adults for decades, I've seen this pattern more times than I can count. It doesn't start with a dramatic injury. It starts with subtle warning signs, tingling, reduced sensation, a slight loss of balance, and most people are told the same thing. It's just part of aging. But that belief is exactly what puts you at risk. Because neuropathy isn't just about discomfort, it's about losing the connection between your brain and your body. Today, I'm going to show you 5 simple chair-based exercises that can begin restoring that connection right from your living room, safely, and more effectively than most people realize. And the first one may change how you feel about your body starting today. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Seated march, the first step to reawakening nerve function in your legs. It may surprise you, but one of the earliest warning signs of nerve decline isn't pain. It's that strange moment when your legs feel slow to respond, like they need a second to catch up when you stand or start walking. Many older adults brush this off as normal aging, but in reality, this hesitation is often your nervous system struggling to send clear signals to your lower body. And if that signal continues to weaken, it doesn't just affect how you walk. It affects your confidence, your balance, and eventually your independence. This is where a simple movement like the seated march becomes incredibly powerful. Sit in a sturdy chair, preferably one that doesn't roll or sink too low. Place both feet flat on the floor, about hip width apart. Now straighten your back, not stiff, but upright enough so your chest is open and your shoulders are relaxed. This posture matters more than most people realize because slouching can actually reduce how effectively your brain communicates with your lower body. From here, slowly lift your right knee toward the ceiling. You don't need to go high, just enough so your foot clears the floor. Then lower it back down with control. Now switch to your left knee. As you do this, allow your arms to move naturally, just like they would if you were walking. Right arm forward with left leg, and vice versa. But here's the key that most people miss. Don't rush it. Each lift should be deliberate. You should feel your thigh muscles engage, your core stabilize your body, and your foot reconnect with the floor every time it comes down. This is not just a movement, it's a message. You are telling your brain, pay attention to my legs again. Start with 30 seconds. That may not sound like much, but if you do it correctly with focus and control, you'll notice your breathing pick up slightly. That's exactly what you want. Increased blood flow means more oxygen and nutrients are being delivered to the nerves that need it most. If 30 seconds feels manageable, work your way up to 1 minute. Over time, you can even break it into short sessions throughout the day, while watching television, waiting for your coffee to brew, or during a commercial break. These small moments add up, and consistency is what drives change in the nervous system. Now, a quick note of caution: if you feel dizzy, overly fatigued, or have severe balance issues, slow it down, or pause. This exercise should challenge you, but it should never feel unsafe. Because the goal here isn't just to move your legs, it's to restore the connection that allows you to stand, walk, and live without hesitation. And once that connection begins to come back, something else follows: confidence. But restoring blood flow is only the beginning. Because if your ankles don't respond when you shift your weight, even strong legs won't keep you steady. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Heel toe rock, the hidden reflex that keeps you from falling. Most people don't realize this until it's too late, but the difference between a steady step and a dangerous fall often comes down to a tiny movement your body used to do automatically, lifting your toes just enough to clear the ground. When that reflex weakens, you don't notice it right away. You simply start shuffling a little more. Your steps get shorter. You feel less stable on uneven surfaces. And then one day, your foot doesn't lift high enough. And that's all it takes. This is exactly what the heel-toe rock exercise is designed to fix. Sit in a firm, stable chair with both feet flat on the floor. Your knees should be bent at about a 90-degree angle, and your back should be upright, not rigid, but supported and aligned. Now bring your attention to your feet. This is important because for many older adults with neuropathy, the brain has slowly stopped listening to signals from this area. Start by pressing the balls of your feet and your toes firmly into the ground, then slowly lift your heels upward. You should feel your calf muscles tighten as your weight shifts slightly forward. Hold that position for just a second, long enough to feel the muscles engage, then gently lower your heels back down. From there, shift in the opposite direction. Keep your heels planted and slowly lift your toes and the front of your feet off the ground. You may feel a tightening along the front of your lower leg. This is a muscle group that is often neglected, yet essential for safe walking. Now continue this motion in a smooth, controlled rhythm. Heels up, down, toes up, down. But here's where most people go wrong. They rush through it. Speed is not your friend here. Control is everything. Each movement should feel intentional, almost like you're teaching your feet how to move again. Because in many ways, you are. Aim for 10 to 15 repetitions, taking your time with each one. If you feel fatigue in your lower legs, that's a good sign. It means those stabilizing muscles are waking up. This exercise does more than strengthen muscles. It retrains your nervous system to recognize where your feet are in space, a sense called proprioception. Without it, your brain is essentially guessing where the ground is, which is why so many falls happen without warning. If you've ever felt unsure stepping off a curb or walking across a carpet that suddenly changes texture, this is exactly the system that needs rebuilding. For safety, always perform this exercise while seated, especially if you already feel unsteady. And if one side feels weaker than the other, that's not unusual. Just move slower and give that side a little more attention. Over time, this simple rocking motion can restore something many people don't even realize they've lost: the ability to trust their next step. Because walking safely isn't about strength alone. It's about how quickly and accurately your body responds in motion. And once your feet begin to respond again, the next challenge isn't just movement, it's coordination, because your body must learn how to work as one connected system again. 3. Seated diagonal reach. Rebuilding the brain to body connection that balance depends on. Have you ever noticed that your balance feels worse when you turn, reach, or try to do two things at once? Not just when you're standing still? That's not a coincidence. Many older adults believe balance is all about the feet, but in reality, it's a full body coordination process controlled by the brain. When neuropathy begins to interfere with the signals coming from your legs, your brain has to work harder to organize movement across your entire body. And if that coordination weakens, even simple daily actions like reaching for something on a shelf or turning to grab your phone can suddenly feel unstable. This is where the seated diagonal reach becomes incredibly valuable. Start by sitting on a firm chair with your feet flat on the ground. Before you even move your arms, gently press your feet down into the floor. This step is not optional. It creates a physical anchor that tells your brain where your body is in space. Many people skip this, and in doing so, they miss the entire purpose of the exercise. Now bring your hands together in front of you. You can clasp them lightly or simply keep them close together if your shoulders feel tight. From here, move your hands slowly down toward one hip, let's say your left side. Then, in one smooth motion, sweep your arms diagonally upward across your body toward your right side, as if you're reaching for something just above shoulder height. Pause briefly at the top, then return slowly to the starting position. This is not about speed or range, it's about control and awareness. As your arms move, your core muscles engage to keep you stable, and your feet press firmly into the ground to maintain balance. This creates a powerful communication loop between your brain, your core, and your lower body. You are essentially training your nervous system to coordinate multiple regions at once. Repeat this motion 10 times on one side, then switch directions, moving from your right hip up toward your left side. Keep your breathing steady. If you notice yourself holding your breath, slow down. Now, here's what makes this exercise especially important for neuropathy. It challenges your brain to manage shifting weight and directional movement without relying solely on your feet. This is critical because in real life, you rarely move in straight lines. You twist, turn, reach, and react, and that's when most falls happen. If you ever feel slightly off balance when rotating your body or reaching across yourself, this is exactly the pattern your body needs to relearn. For those with limited shoulder mobility, you can reduce the height of the reach or perform the movement with arms moving in parallel instead of clasped. The goal is not perfection, it's engagement. And always remember, if you feel discomfort in your back or dizziness, pause and reset your posture before continuing. Because true stability isn't built from isolated strength, it comes from your body learning to move as a connected system again. And once that connection begins to return, the next step is even more subtle. Because deep in your feet are tiny muscles that may have been silent for years, and waking them up can change everything. If you're still watching and finding these insights valuable, please comment number one below to let me know you're here. Now, let's keep going with point number 4. 4. Towel scrunch, the small foot movement that can reawaken lost sensation. There's a quiet loss that happens in many aging bodies, and most people don't notice it until it's advanced. It's not strength. It's not even balance. It's the simple ability to feel and control your toes. If you've ever looked down and realized your feet feel distant or your toes don't respond the way they used to, that's not just stiffness. It's a sign that the communication between your brain and the smallest muscles in your feet is fading. And those small muscles matter more than you think. They are the first line of defense when your body tries to adjust to uneven ground. They help you grip, stabilize, and react before your larger muscles even get involved. When they stop working properly, your entire foundation becomes less reliable. This is exactly why the towel scrunch exercise is so important. Sit comfortably in a sturdy chair with your feet flat on the floor. Place a small hand towel on the ground in front of you. Now, position one foot so your toes are resting on the edge of the towel. From here, gently spread your toes, then begin to pull the towel towards you, using only your toes. Think of it as grabbing the fabric, bunching it up, and drawing it closer inch by inch. At first, this may feel awkward or even frustrating. You might notice that your toes don't seem to cooperate. They may barely move or they may cramp slightly. That's completely normal. In fact, that's the point. These are muscles and nerve pathways that haven't been fully activated in a long time. Go slowly. Focus on the movement. Each small contraction is sending a signal back to your brain, reminding it that these muscles still exist and that they need to be reconnected. Aim for 8 to 10 repetitions on each foot. After one set, take a short break, then repeat. If the towel feels too easy over time, you can increase the challenge by using a thicker towel or even trying to pick up small household items like a sock or a soft object with your toes. Now, here's something important to understand. This exercise isn't about strength in the traditional sense. It's about precision and awareness. You are retraining fine motor control in your feet, which is essential for restoring sensation and improving how your body reacts when you walk. For safety, always check your feet after performing this exercise. If you have reduced sensation, you may not feel irritation or pressure points. Look for redness or discomfort, especially if you're practicing regularly. This is particularly important if you have diabetes or a history of foot issues. Because when sensation decreases, small problems can go unnoticed, and prevention becomes your best protection. Over time, with consistent practice, many people begin to notice subtle but meaningful changes. Their feet feel more awake, their steps feel more grounded, and that lingering sense of disconnection begins to fade. But restoring sensation is only one part of the equation. Because even if your feet can feel again, they still need to move freely. And what you do next will determine how well your ankles respond when your balance is truly tested. 5. Ankle circles and alphabet. The subtle movement that restores control before you even take a step. What most people don't realize is that balance problems rarely start when you're walking. They begin much earlier, in the small, almost invisible movements your ankles are no longer able to control. If your foot feels stiff, slow to react, or uncertain when you shift your weight, that's not just aging joints, it's your nervous system losing its ability to guide your ankle through space with precision. And without that control, even a simple misstep can turn into a fall. This is why one of the most overlooked but incredibly effective chair exercises is ankle circles, combined with what we call the alphabet drill. Sit in a stable chair with both feet flat on the floor. Slowly lift one foot just a few inches off the ground. You don't need to raise it high, just enough so it can move freely without touching the floor. Now begin by drawing slow, controlled circles with your ankle. Imagine your big toe is tracing a perfect circle in the air. Start with 10 circles in one direction, then switch and do 10 in the opposite direction. But here's where the real benefit comes in. Slow it down. The slower you move, the more your brain has to stay engaged. Fast movements allow your body to cheat. Slow movements force your nervous system to pay attention, to adjust, to reconnect. After completing the circles, move on to the alphabet. Using your big toe like a pen, begin writing the letters A through Z in the air. Each letter creates a different movement pattern, some small, some wide, some diagonal. This challenges your ankle from multiple angles, activating muscles and nerve pathways that are rarely used in everyday life. Take your time. There's no rush here. If your ankle feels tight or shaky, that's not a problem. That's information. It tells you exactly where your body needs more attention. Now, a few important points to make this exercise effective. Keep your upper body relaxed and stable. Avoid leaning back or gripping the chair too tightly. Let the movement come from your ankle, not your whole leg. If your thigh starts to tense up, pause and reset. If doing the full alphabet feels too much at first, start with just the first 5 to 10 letters and gradually build up over time. Progression is key, especially for older adults whose nervous systems respond better to gradual challenges rather than sudden overload. And and if you ever feel discomfort, not just muscle fatigue, but sharp or unusual pain, stop and give your body time to recover. What makes this exercise so powerful is that it restores something deeper than flexibility. It rebuilds your ankle's ability to respond quickly and accurately when your balance is tested, like when you step on uneven ground or shift direction unexpectedly. Because in those moments, your body doesn't have time to think, it reacts. And that reaction depends entirely on how well your nervous system and joints are communicating. So while this movement may seem simple, it's laying the groundwork for safer, more confident movement in your daily life. And now that you've seen how each part of your lower body, from circulation to coordination to fine motor control, can be retrained step by step, the real question becomes, what happens if you combine all of these into one simple daily routine? And how much could your stability improve in the next 30 days? What your body is trying to tell you before it's too late. There comes a point in life when the changes in your body are no longer loud or dramatic. They become quiet, subtle, easy to ignore. A little numbness in your feet, a slight delay when you stand, a moment of uncertainty when you take that first step in the morning or get up in the middle of the night. These are not random inconveniences. They are signals. As we age, the body becomes more fragile, not just in strength, but in communication. The connection between your brain and your lower body, something you once took for granted, begins to weaken. And when that connection fades, the risks don't always show up during the day when you're alert and careful. They often appear at night. Think about those moments when you wake up in the dark. You stand up to use the bathroom. Your eyes are still adjusting. Your feet feel slightly numb. Your balance isn't fully awake yet. This is when many falls happen, not because of recklessness, but because the body simply isn't ready. And unfortunately, for adults over 60, one fall can change everything. A fracture, a hospital stay, months of recovery, sometimes a loss of independence that never fully returns. But here's the part that matters most. This future is not inevitable. What you've learned today is not just a set of exercises. It's a way to reconnect your body, to retrain your nervous system, to remind your feet, your legs, and your brain how to work together again. When you take a few minutes each day to move with intention, whether it's lifting your knees, rocking through your feet, engaging your core, or simply asking your toes to move again, you are doing something powerful. You are interrupting the decline. You are rebuilding pathways that time has slowly worn down. Now imagine where this could lead. In the next 30 days, you may notice your steps feel a little more stable. In 3 months, getting out of a chair may feel easier, more automatic. And in 1 to 5 years, the difference becomes even more meaningful. You may still be walking independently, confidently, without fear, while others your age begin to limit their world. That's the real goal here, not perfection, not intensity, but preservation. Because aging is not just about what you lose, it's about what you choose to maintain. So don't wait for a fall to force change. Don't wait until your body gives you no choice. Start now while you still can influence the outcome. Your body is still listening. The question is, are you ready to respond? These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.